We are back with the Hot Box, taking you one step beyond the headlines. Tonight, Oregon Congressman Kurt Schrader. Congressman.
Hi, Stephanie.
Thank you for joining us.
Sure.
So the last time you were here, you were on the fence about this health care reform bill. You did vote for it.
Yep.
Sort of late to the table in terms of making your commitment on Saturday. Tell us a little bit about how that went down.
Well, important piece of legislation. If you want to, I'm a veterinarian in the real world, and the basic axiom is do no harm. So I wanted to make sure that whatever we did, it moved the ball down the field and made sure that insurance was a lot more affordable for every American out there. And this bill got me there. It could be a little better yet, but that's true of every single piece of legislation. And it hit the basic principles I've campaigned on, and I feel pretty good about it.
One of the more controversial aspects of this bill is the restrictions that it places on funding for insurance companies, et cetera, that provide abortions.
Right.
How do you weigh in on this issue?
Well, it was an amendment offered up by Bart Stupak from Michigan and a few other members, both sides of the aisle that are pro-life oriented. The basic goal was to make sure that we didn't interfere with the current federal ban on federal money being used for abortion services in this country. There was some discussion about how far that amendment went versus current law. Ultimately, it was adopted by the body, put into this piece of legislation, and I voted for the piece of legislation.
You voted for the piece of legislation, and now as a result of being in sort of a swing district, you were on the GOP hit list for 2010. So tell me a little bit about your fears. Do you have any? Do you just proceed? What do you do next?
Well, you know, when you take a tough vote on a major issue, that is tough to understand for a lot of Oregonians. I guess my job is in the next 12 months to make sure I make it as understandable as possible. I think on balance, this is a huge benefit for making health care affordable for individuals, businesses, and this country. I'm not especially worried. It's my job. I campaigned on health care reform. I campaigned on recovery for this country economically, getting ourselves energy independent, and building a better education system. And right now I've delivered on all those. So I think I'm in pretty good shape, Stephanie.
Okay, so let's talk about what happens next. As it sits in the Senate, oftentimes when these things get spit back out, they're very different than when it left the House. So what for you will determine whether or not you continue to support this?
That's a good question. What I would make the biggest difference for me was that the costs of the bill will continue to decrease. That will be less expensive a little bit than the House version. It'll still have the public option, still be good for small businesses, still be good for Oregon. There's a lot of good stuff on evidence-based research and making sure Oregon gets its fair share of the reimbursement federal dollars that we haven't gotten for a long time. If those elements are in there, I would more than likely support the final product also. One
of the things we talked about is, you and I were chatting about the difference in the way it's funded. So how do we come to a compromise when the Senate wants to fund it one way and the House wants to fund it another?
Good question, and I don't know. I mean, this is one of those things. We'll see how it comes at the end of the day. Half the bill is funded by efficiencies and improvements in Medicare and Medicaid, not cutting benefits. I want to make that clear to you and everyone out there.
This is on the House
side?
Right.
On both sides. We're not cutting any benefits. Matter of fact, we add benefits, particularly in the prescription drug area. But the controversy is over the other. You know, do we fund it by taxing Cadillac plans or a surcharge?
That's the Senate version.
That's the Senate version. And on the House version, it's a surcharge, not an additional complete tax, but a surcharge on income over $1 million for a family. And so that's the question. Maybe a mix and match of both. Who knows?
And then finally, you mentioned that really you believe that this is an issue about providing stability for the average American in addition to serving the underinsured or uninsured?
Yeah, I've made the case in the course of discussion when I started on this track with healthcare reform. The biggest issue was making it more affordable for everybody, reducing the costs of the increases going forward. That's the reason small business was at the table, the providers are at the table, insurance companies and patients and everyone else is at the table. The cost of health insurance is becoming astronomical. So curbing the cost is by a 2-to-1 margin more important for Americans and Oregonians than adding just more people to a broken system. So that has to happen.
Thanks very much for making the time to speak with us tonight.
Thanks, Stephanie.
All right, let's talk about the web.